Hi, I'm Don Thompson. I'm an acupuncturist and I've practiced over 20 years. For the last 2 to 3 years, I've done some extra training in treating eye diseases with acupuncture and Chinese medicine. And I've trained with two of the leaders in our country, two leading acupuncturists that treat eye diseases, Mott Sexton, who is in Minneapolis, Minnesota, and Andy Rosenfarb, who is just outside of New York City in New Jersey. And some of the things that we've learned to treat in these classes that I've been to or help patients that have macular degeneration, diabetic retinopathy, glaucoma, optic nerve health, dry eye, and eye stroke. And it's kind of been an amazing process to see how well acupuncture can sometimes help these folks. So a lot of people want to know how acupuncture helps treating with eye problems. First of all, acupuncture increases circulation in the body, no matter where you place the needles. Acupuncture works through the brain and the spinal cord, which is the central nervous system, but the eyes are also considered part of the central nervous system. And the heaviest oxygen consumption in our body is not in the areas that you would think it would be, like the heart or the lungs. It's actually in the retina of the eye. And so that's why it's important to have good circulation to the eyes, is because it requires so much oxygen for the health of the eye. The other thing that's important about the way that acupuncture helps with stimulating the nervous system is there are photoreceptors that are in the back of the eye. And these photoreceptors are cones and rods and some other photoreceptors as well. But what happens is with eye problems such as macular degeneration, they often go into a dormant state. Now some of them are dead, and the ones that are dead aren't coming back. But the ones that are dormant, it's very similar to what happens to the earth during the wintertime. It's like the plants die down, everything looks gray and dark. But in the springtime, when you start bringing sunshine and fertilizer and water, things start to grow again. Some of the things that were there in the fall may not come back, but a lot of the grass and other flowers could come back. And that's kind of the same with using the acupuncture to help with those types of vision problems. It's like those dormant rods and cones will start coming back to life, not the ones that are dead, but the ones that are dormant. And that's why people start having improvement in color vision and things get brighter for them and those types of issues. So we don't place any needles in the eye. None of the needles go in the eye. All the points that we use for vision issues are in the hands and the feet, as well as other body points. And those points are based on the initial consult that we do when you come to see us for your eye issues. So what happens when you come to our office for the first visit? Well, first of all, you have to be under the care of an ophthalmologist or an optometrist. We won't see a patient if they're not currently being seen by an ophthalmologist or an eye doctor. And before we start the acupuncture, we'd like for you to have an exam by your doctor at least 2 weeks prior to starting the treatments. And we'd like for that exam to include a visual acuity exam as well as something called an OCT. And that's where it's like an ultrasound for the back of your eye, where your doctor can actually see the health of the blood vessels and all the things that are going on in the back of the eye. And when you come to see us then for your first appointment, we're going to take a detailed Western medical history, as well as I'm going to take a detailed Chinese medical history. And I'm going to find out exactly what's going on in your body and how it's affecting your eye issue. And then I'll choose the acupuncture points based on that. Again, none of the acupuncture needles go in the eyes. All the points go into your hands, your feet, your arms, and your leg. We're also going to come up with things that you can do at home, including dietary changes that might be helpful, exercises, and other lifestyle issues that might help with your eye diseases. We'll then do a series of 20 treatments. We like to do those twice a day for 10 days. And then at the conclusion of those 20 treatments, we'll have you go back to your eye doctor and ask that they do the same test they did prior to starting the acupuncture treatments, which is to measure your visual acuity and do another OCT exam, and then have them compare those test results from the first test to the one concluding the acupuncture treatments. If there's some improvement in the eye health, we'll continue on with series of 10, groups of 10 treatments until we reach a plateau. And at that point, we'll do what is now maintenance treatments for your eyes at that point. That will be required. These eye diseases are chronic illnesses, just like diabetes, Crohn's disease, and some other issues like that. You will require periodic treatments to help maintain the vision improvement or the improvement in the health of your eye. Again, the goal is to keep you from losing more vision, and hopefully some people will gain some vision back. We don't know who's going to be a good candidate for that until we do some treatments, but that's the goal of our treatment, is to maintain the vision that you have, and with those patients that have a certain type of improvements, you may get some vision acuity back. Take a look, there's a couple of videos that are attached to this website of a couple of actual patients that we've seen here in our office, and they'll talk a little bit about their eye diseases and how acupuncture has helped them. We'd like to help you with your eye issues. If you have any questions or concerns, please give us a call. Thank you.